What are the special considerations for pain control in the various dental specialties? In endodontics, the prime considerations are the presence of inflammation and infection, and a consideration for postoperative pain control. Inflammation and infection have a negative effect on both the duration and the depth of local anesthesia. The use of intraosseous anesthesia and the introduction of Articaine have helped to solve this problem. In regards to postoperative pain control, the administration of bupivacaine at the conclusion of endodontic treatment helps to keep the patient comfortable in the postoperative period. In pediatric dentistry, the prime consideration when administering local anesthesia is the increased risk of overdose, especially when treating the young, lighter weight patient. The following factors act to increase the risk of local anesthetic overdose in younger patients. A treatment plan including all 4 quadrants under local anesthesia in one visit. The anesthetic administered is a plain drug. No epinephrine is included. Full cartridges, 1.8 mL, are administered with each injection. The anesthetic is administered to all 4 quadrants at one time and exceeding the maximum dosage based on the patient's body weight. A second consideration in pediatric dentistry are the complications of local anesthesia. Soft tissue injury is more likely to occur in younger patients. This may be minimized by the use of a shorter-acting local anesthetic if it is indicated by the minimum depth and duration of the dental procedure. Warning the patient and their parent or guardian about the possibility of soft tissue injury if the patient bites, sucks, or chews on their lip or cheek while they are still numb, or a cotton roll may be placed between the patient's teeth and their lip, secured with dental floss to prevent injury. A third consideration in pediatric dentistry is technique. All local anesthetic techniques may be used in children, however, the following must be noted. The volume of local anesthetic must be minimized in younger patients. As a general rule, administer only half the volume recommended for adult patients for each technique. When anesthetizing the mandibular primary dentition, infiltration anesthesia will work because the cortical plate of bone in children is not very thick and diffusion of the anesthetic drug will occur. Once the dentition becomes mixed, the cortical plate of bone in the mandible may be too thick and mandibular infiltration should not be attempted. The mental foramen is found between the 2 primary molars. The incisive nerve block may be administered to achieve anesthesia of the primary incisors, canine, and first molar using 1/4 of a cartridge of anesthetic solution. A consideration in oral surgery, periodontics, and dental hygiene is the need for hemostasis. To provide a clean surgical site and to minimize bleeding during surgery, epinephrine is injected by infiltration into the surgical site. A 1 to 100,000 concentration may be used even though there is a slightly greater hemostatic effect with 1 to 50,000 epinephrine. Inject only enough local anesthetic with epinephrine into the site to produce visible whitening or ischemia of the soft tissues. Another consideration is post-surgical pain control. The administration of bupivacaine at the conclusion of treatment helps in keeping the patient comfortable following surgical procedures.